do need health insurance, and they do delay seeking care because they don't have health insurance, and they do fall into bankruptcy or fall into Medicaid if they get really sick or end up in the hospital. Hopefully that donut hole, the gap gets closed, though it's going to take a while. It could have been
Tell them what the donut hole is.
That's the prescription coverage program for seniors on Medicare, and you have coverage up until around I want to say $3,500, and then you have no coverage up until around $5,000. So there's a donut hole. There's a big gap in there, and about 17% of seniors fall into that donut hole, and you go from having reasonable prescription coverage to no coverage. I see that often. I'll see patients, and they're usually, if you have prescription coverage that are up around $3,000, $4,000 a year, you tend to be relatively sick. You have a lot of medical problems. So now all of a sudden you don't have any prescription coverage. It becomes quite a hardship, and then those patients, they stop taking their medicines or they cut back, and then it's not unlikely that they end up getting sicker and then fall into the hospital or in the ER with some illness that hopefully could have been prevented.
Yes, especially since many of our pharmaceuticals are just gouging the public. I mean, they make a pill for 10 cents. They're charging $100 or $50 for the damn thing, and they don't care. They're cleaning our clock, especially since we developed most of those things on federal funding anyway.
Yeah, well, that's true. About half of the basic research, at least the basic research for new prescriptions, come from the federal government in the United States, and that does get passed on to the pharmaceutical industry, and the drug costs here are much higher than in the other countries that have universal health systems. Yeah, it could be better. I think their sales, if you actually had prescription coverage for everybody, they wouldn't have to market as much, they wouldn't have to waste as much money whining and dining physicians and all the things they do, all the TV ads.
And congressmen.
And congressmen.
Millions to the congressmen, and you see the pictures of them dancing and partying away out in the South Sea, Caribbean island somewhere, all paid for by the healthcare industries.
So actually people would more likely fill their prescriptions, and so I think they would actually they may have even more sales. Another, though, good thing in the prescription, or in the bill, was they did put in some stiffer laws or regulations on the wining and dining of physicians. So now any gifts to physicians over $10 has to be that's publicly public recording or
information,
and so that's really going to put a damper on it. I think physicians are going to do less of it, and I see,
so.
And they need to. I mean, physicians don't need to have their dinners paid for while they're being educated on new medications or something.
Right. And vacations and transportation, all those other things will kind of fit into it. They'll get around it, though, Rudy. You believe me, I think these are pretty crafty people. They'll figure out a way around that.
Well, one way they're getting around it is they're paying for the education programs for physicians. They're paying the speakers who come in and give the programs large amounts of money, and
there are other doctors, of course.
Yeah, right. So they may get $1,000 or $2,000 to give a talk, and are they biased towards the whatever medicine that pharmaceutical company promotes? Not always, but probably sometimes.
It kind of reminds me of George Bush, the elder. They were involved in a company called the Carlyle Group, which was building, they'd buy old arms factories that were going bankrupt because there weren't any wars. And they put together a big bunch of them, and he was on their board as a member and quite active in it. And then, of course, his son declared war in Iraq and suddenly, and gave them an unbid contract, I might add, his own father's company. And Halliburton was the other one. They had two unbid contracts, and Suddenly George Bush Sr. was on the speaker's trail, and they gave him huge amounts of money to give a talk, and they paid for it. I wonder what that, there's always a way to pay people off, Rudy. I don't know. How do they pay off Congress? There are a million ways. Try to figure it out, huh? The guy who set up the pharmaceutical program, who was the chairman, promptly resigned, took his millions in campaign funds, and was made the president or director of one of the largest pharmaceutical companies in the world.
Yep.
Thank you for screwing us. A lot of phone calls. You want to take a call?
Sure.
Hey, okay, morning. Good morning, caller. Thank you for waiting.
Hello.
Hello there.
Hello, I'd like to ask the doctor about Medicare.
All right.
What's the question?
Well, the question, how could it be improved? I use Medicare, and I'm very happy with it at this point.
Well, how it could be improved? Well, one, with that donut hole, that gap, that there is a significant gap in prescription coverage that needs to be closed, and hopefully this bill will do it. Another way it could be improved, actually the out-of-pocket deductibles are going much higher, and when you raise out-of-pocket costs or deductibles, it tends to hurt the patients who are poor or who are sick, and I think seniors are more likely to get sick, obviously, because of age and chronic illnesses finally catching up to them. So I'm not so sure it's economically, it's definitely harmful to their health, but I'm not so sure that even economically, whether it saves money by raising deductibles and driving up out-of-pocket costs on the elderly.
Especially when they have had no cost of living, and not a meaningful one, for years. They've literally gone down a 50% of the dollar now that they used to get 8 years ago, Rudy. And this year there's no cost of living increase. They're just going to take more money for your Medicare.
So you can have health insurance, but if your out-of-pocket costs or your deductibles are really high, you could be you're underinsured, and you frequently act like if you had no health insurance. So they do delay seeking care. And these are U.S. studies. These aren't studies done in other countries, where it shows that patients will then crash into the emergency room with illnesses, complications from illnesses that could have been treated or prevented or treated as an outpatient. For instance, the biggest ones are heart failure, diabetes, respiratory illnesses like COPD and asthma. Those are very treatable. But if they, in an outpatient setting are preventable, you're not going to prevent everything. But again, if you make the out-of-pocket costs too high, the deductibles too high, the patients will delay seeking care or not take the medicine or fill the prescription, etc. And study after study shows that. So I don't think we're really saving money by driving the out-of-pocket costs up on seniors. Or making their deductibles higher.
And of course you realize, caller, that half of all bankruptcies are healthcare related. People under, and 3/4 of those people that did go bankrupt had healthcare insurance. So as you say, just because you have the insurance, you're not necessarily insured.
Right. Well, that and I think so. I think the number of underinsured in this country is climbing. We hear the word uninsured, this number of 40, 50 million, 45 million, whatever, but there's a group just as big as that are underinsured, and they don't always act like the uninsured, but frequently they do. So hopefully this bill will reverse that trend. Again, for seniors, closing that donut hole gap, that should help, covering people up to 26. Pre-existing conditions, that getting, obviously, people can't get health insurance in the past because of pre-existing conditions. Hopefully that gets eliminated, and
dumping people who get sick.
Oh yeah, well that's the cherry picking that the private health insurance industry does. It's pretty, it's not funny, but the way it's set up, Who's most likely to get sick in a nation are the elderly